Well, good afternoon, everyone. Well, it's almost afternoon. I'm Dr. Roxanna Anderson, and I am happy to present a favorite topic of mine, something that has been ruminating in my head for at least the last 10 years. And within the last 3 or 4 years, I've actually began to think about putting a program together so that I could inform and educate other people around the country. So, the topic is called Transgenerational Trauma from Freedom to Slavery. And just, I will speak over my PowerPoint presentation. So the historical context really discusses what the African diaspora really is. And it's a term commonly used to describe mass dispersion of Africa, of people from Africa during the transatlantic slave trades from the 1500s to the 1800s. The diaspora took millions of people from Western and Central Africa to different regions throughout the Americas and the Caribbean. Up in the corner, the right-hand corner, I have what's called the Pan-African flag. And this is something that African Americans have, usually different objects of these colors in their home. The red stands for the blood that unites people of African ancestry and are shed for liberation. The black stands for people, us, whose existence as a nation, though not a nation state, is affirmed by the existence of the flag. And the green is the abundant natural wealth of Africa. So this is a slide of the diaspora, which includes 140 million individuals, and they were dispersed across the following countries and continents: Brazil, United States, Haiti, Dominican Republic, Colombia, France, and Venezuela, and the accompanying numbers that transferred. And if you take a look, the highest actually was in Brazil. So 55 million people actually dispersed throughout Brazil, only 10 to Haiti, and only 9 million to the Dominican Republic. So it's very interesting to think of how many people actually arrived in Brazil. And some of the other nations that we all know, of course, are Jamaica, the United Kingdom, Mexico, Peru, Cuba, Canada, Italy, Puerto Rico, Germany, Spain, Ecuador, Trinidad and Tobago, Barbados, Guyana, Suriname, Argentina, Grenada. So let's define trauma. And I have a couple of ways of doing that. But overall, when we talk about trauma, we're talking about trauma as an anxiety disorder which develops in some individuals after extremely traumatic events. And some of these events are being in war, in combat, crime, being the victim of a crime, being raped, having an accident like a car accident, and natural disasters, hurricane, tornadoes, earthquakes. In terms of transgenerational trauma, we're looking at trauma that's transferred from the first generation of trauma survivors to the second and further generations of offspring of the survivors via what we would call complex post-traumatic stress disorder mechanisms. And I'm going to discuss some of those mechanisms as we go along. So why focus on African Americans? Because research supports the concept of intergenerational trauma. There is something called the Adverse Childhood Experience Survey, which I actually give to all of my students in class so that they can kind of understand some of the household characteristics that could be an outcome or could be the reason for trauma later on. So, and ACEs are also potentially traumatic experiences that can have negative, lasting effects on health and well-being. These experiences range from physical, emotional, or sexual abuse to parental divorce or incarceration of a parent or guardian. and that's from the Center for Disease Control. So here is a list of adverse childhood experiences. Individuals, children between the ages of 0 and 17, if they have encountered sexual abuse, emotional abuse, physical neglect, emotional neglect, intimate partner violence, mother treated violently, parental separation, divorce, and incarcerated household member. Some of the outcomes are suicide attempts, lifetime depressive episodes, sleep disturbances in adults, high-risk sexual behaviors, fetal mortality, and pregnancy outcomes. And we would want individuals who are pregnant to really hone in on the issues that I've presented here, because they can have effects on the unborn fetus. So here is a triangle that represents the different kinds of abuses and the long-term effects. So the adverse childhood experiences, and if you have more of those experiences, you can see the arrow going up to death, at the probability of inheriting or having some of these physical, mental outcomes increases exponentially. So if you take a look at the bottom, adverse childhood experiences, then comes social, emotional, and cognitive development is impaired. Adoption of health behaviors, risky health behaviors, then disease, disability, and social problems, and lastly, early death. The reason I interject this adverse childhood experiences within the concept of traumatic experiences is that even though this occurred during slavery, this still occurs today, and the outcome is similar. So here are my trauma scenarios. And these are the scenarios that individuals underwent during the period from the 1500s to the 1800s. So prior to slavery, Africans were in heated wars among various tribes, and when engaging in warfare, often captured the losers. Those captured were assimilated into the tribe. When slavery began, they were sold to the slavers, and this is trauma 1. Trauma 2 occurred during the Middle Passage, when they were enslaved on the ships crossing the vast oceans, which could take up to 3 to 6 months. They were chained together, unable to move, and were defecated and urinated upon one another. Trauma 3 occurred when the ship offloaded their chattel and sold them in the marketplaces. Here are some images of the ship and the hold of the ship, and how individual slaves were planked, or they were lying on these individual boards. They were chained to these boards. And this is another image below it of how they were uh, cargoed through the Middle Passage. And then once they reached land, they were offloaded, and then they were then transported to the marketplaces in various ways. And this is one of the ways in which they would have been transported to the marketplace. So on to my further trauma scenarios. So trauma 4 occurred when we were enslaved and sold to other plantations. Here is another kind of a trauma called attachment trauma. And this is sort of akin to the separation and the divorce, but this can be much more violently, it occurs more violently when you think about it happening during times of enslavement. So there are actual outcomes from individuals who are separated from their parents. Trauma 5, freedom. Well, you would have thought it would be a relief, but not as many people had the ability to read and write, nor have employable skills. Trauma 6, Jim Crow. This was racial segregation in the South between the end of Reconstruction in 1877 and the beginning of the Civil Rights Movement in 1950. 7, discrimination, employment, housing, medical, and what I would call microaggressions. So here is imitation of image of plantation life, and you can see individuals picking cotton. So why are these historical stages at all important? To demonstrate the number of times people have been traumatized, to discuss the different changes which occur in the DNA due to trauma, and to discuss possible solutions. Epigenetics and trauma. Genes are either turned on or off based on prior environmental exposure. So if you remember the ACEs that I mentioned and all the traumas that occurred, then the genes with which we are born can be affected throughout those incidents. And here's an example. So in the Netherlands during the Nazi occupation, there was a food shortage. Women gave birth to children who later experienced greater incidence of cardiovascular disease and obesity. This was not the only occurrence. The other one occurred in Finland, and using archival data, they tracked the descendants of individuals who suffered through famine and found the same similar outcomes of disease. So this gives us the idea that past events, and you would think that starving isn't a real trauma, but it has effects on the body. So another definition of trauma is called historical trauma, and that's defined as the emotional and psychological wounding across generations, including the lifespan, which emanates from massive group trauma. And those are the individuals who actually conducted the research. So why is this even important? Well, we now have access to genetics. And this tells us that the outcome of trauma is inherited. In other words, it's possible that ancestral DNA causes their progeny to inherit genes which cause various diseases. For example, the Middle Passage is responsible for cardiovascular disease due to the lack of appropriate food. And the wounds of slavery and its outgrowth can be the thorn in the eye of African Americans today. So genetics now informs us that many mental health disorders have a genetic base. So genetics, which is DNA that contains genes which have instructions for making protein, resulting in who we become, our minds and our bodies. So when trauma occurs, a gene becomes methylated. This is a chemical term that says that the gene has been abridged in some kind of way. So it has changed. Each gene has several letters, GTAC, and these letters come in certain base pairs. So you can methylate a gene. So for the GT, they can change the G to a T and the T to the G, and also with the A and the C. And how do we know this? There was the Human Genome Project, which had geneticists who named the various genes involved in causing symptoms of schizophrenia, bipolar disorder, depression, and possibly personality disorders. So here are the DNA, chromosomes, and genes. So I thought I would provide you a picture. And here is a chromosome. We inherit 46. We get 23 from our mother and 23 from our father, and they are paired. And each pair has the DNA, and you can see the DNA within the chromosome, and the DNA has genes, and these are the long parallel lines that you can see. So what's epigenetics? So often genes on our DNA mutate, causing long-standing outcomes which affect those who greatly suffer. For example, researchers found that Holocaust survivors' parenting styles are unique due to their ancestors' theory of being um, murdered, incarcerated, tortured, etc. So this was one of the researches that sort of supports the idea that prior causes, events really change how we see and view the world. And our bodies also change at the same rate. So individuals born to mothers who abuse alcohol and drugs have inherited a gene which, under the right circumstances, serves to promote substance abuse in children. Bereavement can be a trauma, depending upon how it's handled. And last but not least, children are affected due to the loss of their parents. And this can be from a different way. Even simple as separation and divorce can be a trauma based on how it's handled when discussing it with children. So here is an example of how the DNA changes. So these are two different figures. This is the one I sort of like because it kind of shows you how a gene can be affected by this change. And we're never sure whether the gene just turned on or whether it's turned off. But the process is either on or off, which then causes negative outcomes. So here are some of the mental health disorders that are inherited as a consequence of trauma. So ADHD occurs due to the delay in maturation of the brain, resulting in impulsivity and inattention, which causes parents to think their child is being disobedient, but they just cannot hold the instructions in their brain long enough to actually do the thing that the parent wants them to do. So the parent thinks, oh my God, they're not paying attention to me. And so then punish them. And then accompanied with the impulsivity is the inattention. They only hear part of the instructions and then can't attend to it long enough to actually complete the deed. So you can see how this can be very complicated when someone is going to school, which is why they recommend that children take medication, and there's a variety of those, and they're getting better at this. Then there's autism spectrum disorder, also inherited. And there are various symptoms, some of which are called dampened empathy, meaning they don't have the ability to really see um, sadness in other people or happiness in other people. They lack social skills and repetitive behaviors. And the outcome in an autistic individual or person with autism is the part of their brain that is responsible for understanding empathy, or called the limbic system, is damaged. Anxiety disorders, they involve more than just temporary worry or fear. It can lead to panic disorder. Depression is a very common disorder, and that results in fatigue, hopelessness, lack of motivation, eating and sleeping extremes, and sometimes suicide. Bipolar disorders, and there are three of them. It was called manic depression, and this causes alternating symptoms of euphoria and depression. And when you're euphoric, you're speaking rapidly, you have impulsivity, you have inattention, which means you have difficulty concentrating, difficulty in planning, and so are more likely to conduct risky behaviors because you don't have the ability to plan so that you can forestall engaging in risky activities. I included some brain images so people could see the difference between a normal brain and a brain that's suffering from a form of mental illness. So the first one shows you the difference in a child that suffers from attention hyperactivity deficit disorder. And we know that this continues into adulthood, but adulthood ADHD and childhood ADHD are different because as one gets older, the brain matures more, allowing for some of those behavior to be not as extreme as they were when they were children. The second image is one of someone suffering from depression. You can see that in a normal brain, there is activity occurring, which are the yellow and red images that you can see. But you can see in a depressed person, there is no activity. And so therefore they are more lethargic, feeling of tiredness, lack of motivation, because there's very little activity in the brain. So it's not someone just not wanting to engage, they have it's the inability to engage. Here is a normal brain and a bipolar brain. And this is what would be the normal activity, just like you see in the depressed individual. But when they are suffering from mania, their brain is sort of lights up. I always tell my students like a Christmas tree. So you see this heightened activity in the brain. And here, let me just explain that this is the front of the brain here. So this is where you would do all your planning and reasoning. And you can see that there's an enormous amount of activity occurring. Here is the occipital lobe, or where your vision is. Here is the auditory and verbal area of the brain, which is causes the rapidity of speech as well as the euphoria. And here you have the two brains of an individual with schizophrenia on this side and those without. And you can see the brain of the individual with schizophrenia. There, you have two kinds of circumstances occurring. One, if you take a look at the edges of the cortex of the brain itself is shrunken. So it has less white and gray matter than the brain here. And the ventricles here are larger than the ventricles here. And these ventricles, the assumption is, contain more dopamine, which is a neurotransmitter. So the other two mental health disorders that are inherited are schizophrenia spectrum disorder, with symptoms of hallucinations, both auditory and verbal. And it comes up with illogical speech patterns, lack of motivation, motor retardation, or restlessness, and then addiction. One can be addicted to substances, gambling, food. There's a variety of addictions. So here are further brain images of an individual with autism. Here's your control or your normal brain where you see activity. This is of an 11-year-old boy. And this is an individual suffering from autism. And you can see here that there's less matter being utilized during an activity. Here you can see the red and the yellow here and here and here. And if you look here, you will see that there's little activity occurring in this part of the brain. And this is the part of the brain that is responsible for our emotions. And so you can see that this area is damaged. This is a healthy brain and a diseased brain. This one is an individual suffering from cocaine addiction. So you can see here the normal brain with this nice activity occurring. Here is the temporal lobe for hearing and the occipital lobe. And here you can see the diseased brain. And you can see how much more is going on here or how much less is going on here, and how much more is going on here. And lastly, the non-alcoholic brain and the alcoholic brain. So here there's less white and gray matter. So that means that some areas of cognition are going to be damaged. And the same thing happens here. Cognition, meaning thinking, is damaged. And these are things that we have to be aware of in the changes that occur to people who are suffering from these disorders. So it's not willful activity, it's what occurs to the brain that affects how their brains interact with the environment. So what can we do? First of all, we have to reduce the stigma through education of mental health issues. And this is how we free ourselves. So we need to get help. So we need to find a healthcare provider or get treatment. And treatment for mental illnesses usually consists of both therapy, medication, or a combination of the two. And the people who are involved in that are psychiatrists and psychologists. I forgot to include social workers. Sorry, any social workers out there. But psychologists, counselors, therapists, and they use various forms of therapy to provide support and coping skills. And that's the end of the presentation. I didn't have much time, and I hope I gave you enough information so that now what you can do is to ask questions so that I can elucidate more.
Well, thank you so much, Dr. Anderson. That was awesome. Does anybody have questions for her? If you want to, oh, Margaret Newton raised her hand. So if you use the Q&A feature, you can submit your questions there. Great information. Thank you. Yeah, you're welcome. Of course. You can also just chat your question too. I don't see any on Facebook, so we're just seeing if there's any in here. I know Margaret raised her hand, but I don't. Oh, okay. One question. How long does it take for either drugs or alcohol to affect the brain?
Great question. How long does it take? Well, the brain images I showed you was after a long period of addiction to the substances. An addiction is very individual in that we don't understand quite why some people are social drinkers and can drink and why other people become addicted, but we do believe that the addiction occurs because one already has the gene for addiction. And so it turns the genes either on or off. How long? I would say a year. I mean, it doesn't take long before some of our students, you know, who have those binge weekends, it happens pretty quickly.
Okay. Thank you.
How does an early death? I see that.
Yes.
So that's a great question. When a person dies early and they have a child, the child becomes traumatized, not just by the death of the parent, but it's a loss. It's a trauma. And we now know there's something called attachment trauma, meaning the attachment, if it was a very good attachment between the child and the parent, then that child will suffer what we call attachment disorder. And typically we just think people will get over it in time. And some of that's true, but it's also very helpful for that person to receive some treatment and to be and to get a therapist.
Awesome. Walter has a question.
Yes.
Also with alcohol, does casual drinking have similar effects?
No, casual does not, but it would be smart for those people who casually drink to still engage in healthy lifestyles, including exercise, a healthy diet, and making sure that you're taking the proper supplementary vitamins.
Awesome. So we'll answer the question from Sarah, then go back to another question that Walter has. So Sarah asked, can the brain repair itself when a person gives up the substance that they're addicted to?
That's a great question, and I'm glad you asked because I didn't include that. But yes, the brain can repair itself. I would say to anyone who is suffering from addiction or knows someone who has an addiction, they should get involved in AA or NA, Alcoholics Anonymous, Narcotics Anonymous. Those are really tried and true treatment that help individuals not normalize, I don't want to say that, but to become, to get a support network and to find out what's involved and what happens, and that this is what happens to people who abuse substances. And so if you've lost your family and people have died, you can see that this happens to be, quote, a normal
Mhm.
experience. Um, but what happens is the brain is plastic. And so therefore, as long as you're a growing person, your brain can repair itself. But again, engaging in healthy lifestyles. But the brain can come back in a couple of years.
Mhm. Awesome. So another question from Walter, what does attachment disorder entail?
Attachment disorder entails the same kind of outcomes as you saw when we talked about ACEs. So some of the traumas could result in anxiety disorders or being very anxious, being very dependent, and sometimes codependency can occur. But the same kinds of outcomes, substance abuse, depression, same mental health issues can occur if the individuals are not in treatment, because they do need to have a therapist that they can talk to so that they can discuss some of the things that occurred following and during the period of a parent child, and then those things that are missed following the separation. But this can also happen in divorce and separation.
Awesome. What kind of test can my mother take to, I believe, show her level of memory or lack of memory?
Good question. At least here in Florida, there are some memory skills um, centers where you can go and have the test done. There's some online too. You
Mhm.
can go to Google and put in memory test, and they have a variety of those online that you can use to see how good your memory is.
Mhm.
Most therapists, the first thing they do after noting your history is to give you what's called a mental status examination, which includes memory, little memory events to test your memory.
Awesome. And then our last question as of right now, can you elaborate more on the effects of people living in communities exposed to systemic/institutional racism for long periods of time?
Oh gosh. Uh, I'm glad that question was asked because I didn't have time to really discuss it. But living in an environment that consists of consistent trauma, and let me kind of illustrate what I mean. So you go to school, and if you're subjected to racism and discrimination, that's a hit. That's a hit on your self-esteem. So it can lower your self-esteem because instead of hearing positive comments about who you are, you get negative comments. I'm going to give you an example of a child who got a homework assignment back where the teacher had written, "You are stupid, stupid, stupid." That can stick with a child throughout their lifetime. And if there aren't uh, treatment or a parent that can say, "You're not stupid, don't believe that teacher," because a teacher is an authoritarian, is in an authoritative position. So you believe that an older person telling you're stupid. So you need that to be countered by people who say you are not stupid. So that's just one example. Then you come home and you have to walk through a neighborhood where there's activity of drug dealing, of burglaries, murders, and things of that nature, or seeing someone killed. Those are additional traumas. These are not normal events. Now, but let me say this, if it becomes normalized that this is what you see all the time, then that can hamper the brain's growth, meaning where the genes are supposed to go to produce parts of your body, those become truncated. So rather than producing a good outcome, it produces a negative outcome because the body is consistently receiving an onslaught of stress. Now, what happens with stress? Stress produces two kinds of outcomes. One is cortisol. Cortisol gets into your bloodstream and circulates to your brain, and then it affects your memory, or the part of your brain that's responsible for processing memory, and that's the hippocampus. And then that has an effect on how you learn, how you memorize. And then another one is called BDNF, which is brain-derived neurotropic factor, fancy name for another chemical that also travels to your brain and affects your hippocampus. And they've done research on children in these kinds of situations where there was trauma and children not trauma, and they have noticed that that part of their brain was damaged in situations of trauma.
Awesome. Thank you so much. Uh, I do not see any other questions. Give it another few seconds to see if anybody has anything. But thank you guys for all the great questions. These were awesome. Yeah, I know the time frame didn't allow you to elaborate as much as you wanted to, so this was great.
Let me just say a couple of more things since I have time.
Absolutely.
The highest disorder that exists is called anxiety. It's the most traumatic experience an individual can have. And some anxiety disorders become panic disorders. And a lot of people have suffered from panic disorders. These are those momentary fight or flight feelings. So let me give you an example. You're walking down the street and all of a sudden there's a lion that jumps out in front of you. So your first reaction is to flee or fight or flight, right? So your body prepares itself to do one or two things, either to run away or to fight. And so there's a bunch of enabling activities in your body. So that includes your pupil dilates, the saliva disappears, your heart starts racing, blood starts coursing to all of your lower extremities, and your digestion shuts down. So just assume that your fight or flight occurs as you're walking down, and now you're in a fight or flight. That's called a panic disorder. That's also the same consequence of stress. So when that happens, your immune system lowers, and then you become accessible to every little thing flying around. Oh, which reminds me, COVID-19. Now, some people don't want to understand how vital it is to cover and to stay 6 feet apart, because so there's something called survival of the fittest, right? So we adapt over time so that we can live in our world. So does the virus. The virus wants to live. It wants to procreate. It wants to make more of itself. It wants to replicate. And so, if you imagine a ball trying to get into your body and it's trying to find a way into one of your openings, so it realizes that it's too big to get in, so it'll get smaller and smaller and smaller and smaller and smaller and smaller. And then pretty soon it finds a way in. Well, that's what the variants do. Those are the parts of those are the viruses that have changed, mutated, so they can survive. And these things, these viruses, there's a wonderful magazine that I think it was the Time or Newsweek, it did one on viruses and why we have to have viruses in our environment. But these will mutate so that it can live. And if it can find a way into your body, it can proliferate inside your body. And it can cause lung problems and also brain problems. We've seen some people develop psychosis. We've seen people who've had double lung transplants. This COVID is not a joke. You must protect yourself.
Definitely. And we actually did get another question. What conversations should be discussed in African American communities about normalizing mental health and asking for help?
I wish I knew the answer to that question. It's one that I've tried to figure out. This is the presentation that I hope, of course, it would have to be longer. And I've given it in a couple of scenarios in conferences so that more and more people can learn that it's not one of pulling yourself up by your bootstrings. You can't tell a person to pull themselves up by their bootstrings if they have depression. It's a biological change in the brain. And I think by educating and having like the Boynton Library doing this, other community places can do it. The church can do it.
Mm-hmm.
It would be a good place to invite me to come to the church to explain it to the congregation that this is biological. Just like you pass on heart disease, diabetes, and other diseases, you can pass on a gene for mental illness. Education.
Yeah. Education, not being afraid to have those conversations in the first place and
Good,
just
yes.
getting, more people to give their feedback and their experiences with dealing with mental health.
And also to notice the people around you and to be the individual that intervenes.
Mm-hmm.
You must intervene. And you shouldn't be, well, what will they think of me? I don't care what you think of me. I am going to help you no matter what you want. And people say, well, mind your business. No, I'm not going to mind my business. I'm going to let you know that I think that there's a problem.
Mm-hmm.
And I said this to a client last night who I've been working with since December. And it's taken me all this time in talking with her to realize that she just doesn't have anxiety and depression. She
Yeah.
has bipolar disorder.
Yeah.
So I just say that because it took me 6 weeks and
Mm-hmm.
I'm trained.
A lot of people don't realize that they have mental
Health disorder.
disorders until someone else intervenes and helps them get to that realization.
Right.
Yeah. They're
And,
not
and,
something that can
and
be
frankly,
out.
you can be, there's lots of people who have these disorders, even with
Mm-hmm.
autism spectrum disorders. There are people who become successful. There
Yeah.
are PhDs in economics, Nobel Prize winners in economics. Oh, Temple Grandin is a woman who has a PhD and she has autism spectrum disorder.
Mm-hmm.
So it
Yeah.
depends on what parents do when raising their children.
Mm-hmm. Yeah, I always remember this one video I watched of this person who has autism. And she was like, she always gets this comment, oh, well, you don't look like you have autism. Well, what does autism look like? That's why it's a spectrum, because people can
Exactly.
have different symptoms and different effects. There's not one look or diagnosis for autism. So
Or
yeah.
anything.
Yeah.
ADHD. And here's the one I want to talk about too, and that's the ADHD. Lots of children can have ADHD because their parents have ADHD or another mental illness.
Mm-hmm.
And so they still send the gene to the child, and the child's body will do with it what it will. So it could methylate into ADHD. So the kind of environment that that child finds itself in can determine the long-term outcome of that individual. That person can either develop, well, here's a trajectory. ADHD, if not properly diagnosed and everyone knows about it and works with it, it winds up in something called conduct disorder when you become 18 years of age.
Mhm.
Conduct disorder can lead to juvenile delinquency, can lead to incarceration, and that's step by step proven. So the environment has to be a nurturing environment. It has to be one that understands it and make sure that they get the proper kind of mental health. So it's not a stigma to have a child who doesn't appear to be following instructions. It's because of the brain not having properly matured, so they
Yeah.
can't follow instructions.
Mhm. And everybody matures at different rates and in different ways, you know. So I've known some people in my family who have struggled a lot in elementary school, and they get to middle school, which is a different environment, different
Mhm.
age, and they're totally fine. So,
Yeah,
yeah, you really just don't know.
no, you don't.
Nope. Awesome. Well, I don't see any other questions. Uh, so I think we can close it here. Thank you so much again, Dr. Anderson, for giving this presentation and for answering all of these great questions we had today. This was awesome.
It was.
Thank you to everyone for attending. The library, we have virtual programs every month with different topics. This month, the focus was Black History Month, but yeah, we have new stuff every month. So if you would like to register for programs, you can go to the library's website. They're on there. And yeah, I hope everyone has a great day and
I
an
think
awesome
so.
weekend.
Bye, everyone. Thank you for
Bye.
coming.